Procedure for putting on and removing Level C protection. Occasionally, law enforcement or other first responders may be required to operate in high-risk environments, requiring them to wear a combination of personal protective equipment which provides full body and respiratory protection. There are 4 standard combinations of personal protective equipment, or PPE, referred to as Level A, Level B, Level C, and Level D protection. The combination of PPE used for each level of protection is different. Levels A and B are used in extreme and high-risk chemical, biological, or radiological threat environments, and only by trained specialist responders. The most common levels of protection used by law enforcement and other first responders are levels C and D. In this video, we'll look at the procedure for putting on Level C protection as well as the procedure for its correct removal using a method called dry decontamination. Level C protection is commonly used in clandestine drug laboratories or other environments where low to moderate chemical hazards are present, including splash, aerosol, and low to moderate vapor or gas hazards. Officers should have some training in the correct use of this PPE and also be supervised by a trained hazmat or other appropriate officer when using and removing this PPE. Level C will normally consist of a chemical-resistant coverall, full-face air-purifying respirator mask or APR and canister, inner and outer gloves, and chemical-resistant boots. Coveralls used in Level C should be certified to a minimum of Category 3, Type 5 and Type 6 for both solid particulate and liquid chemical protection. Carefully select the correct size of chemical-resistant coverall and check the expiry date. If the suit is too small, it can rip, split, or not allow you to have free or functional movement. It's better to be one size too big than too small. The PPE should always be put on in a clean environment. Putting on the suit is easier if you can sit down. Remove any footwear and tuck any long pants into your socks. Put the suit on starting with the leg. Put on disposable overboots or reusable rubber boots, whichever is available. Pull the legs of the suit down over the top of the boots. And with assistance, tape these to the suit. Whenever taping boots or other PPE to the coveralls, make a tab by folding the end of the tape over on itself. This will help to remove the tape later during decontamination. Put on a pair of nitrile gloves. These will be referred to as your inner gloves. Insert your arms through the sleeves, lifting the suit up over your shoulders. With assistance, tape the inner gloves to the cuff or sleeve of the suit. At this point, it is recommended to put on your APR. Loosen all the straps on the mask. Holding the straps, place your chin into the chin cup at the bottom of the mask. Position the mask onto your face as you pull the straps over your head. Then you should perform what is called a user fit test. This is done by covering the front of the canister with the palm of your hand, taking a sharp breath in and hold it. If you have an effective seal, the mask should remain suctioned to your face until you remove your hand. Once your APR is on and tested, pull the hood of the suit over your head. Zip the suit up to the top. Most Category 3 Type 6 coveralls should have a storm flap at the front of the suit over the zip with an adhesive strip to help seal the suit. The assistant should remove any adhesive backing and seal the flap to the suit, starting at the bottom and moving up to the top. The assistant should then ensure the hood of the coverall is over the edge of the APR mask and then tape the hood around the mask. This ensures that the suit is properly sealed and prevents the hood from pulling away from the mask and exposing your head, hair or skin, which can happen when bending over or kneeling while wearing this type of PPE. Now put on a second or outer pair of gloves. The type of outer gloves may vary depending on the hazards present or the role being performed. In high-risk environments, when undertaking any manual handling or where chemicals are present, wearing heavy-duty chemical gloves is recommended. Finally, the assistant should perform a buddy check, making sure that all items of PPE are fitted correctly and the suit is sealed with no splits or tears. You are now ready to enter the hazard or work environment. Procedure for removing Level C protection. The technique for removing the Level C protection is very important. When you have been operating in a contaminated environment, the external surfaces of all PPE items worn or used must be treated as contaminated. Regardless of the potential contaminant, the risk of exposure, cross-contamination or infection is increased significantly if the PPE is not removed correctly. Ideally, when wearing Level C protection, officers should have the support of a hazmat or similar team to assist in decontaminating officers using a wet decontamination method, including using commercial decontamination solutions or washing down and scrubbing officers as they exit the contaminated environment. This type of wet decontamination, while preferred, is not always possible in some operational environments. In these cases, a method called dry decontamination or simply dry decon can be used. Dry decon, as with any decontamination, requires the assistance of another officer, normally designated as the decon officer, who should also be wearing the correct level of PPE for the hazard present. The objective of the dry decon method is to ensure that as the PPE is removed, your body or hands do not make contact with the outside surface of the PPE. To remove the PPE, stand in a designated decon area or inside a decon bag placed on the ground. Remove any outer gloves. Remove the tape from around the hood, mask and front flap. Remove the tape from the inner gloves and suit. Open the front flap and unzip. The decon officer should then remove the hood from your head, turning it inside out as they remove it and roll it downward. Remember, no part of your body should touch the outside of the suit, and the decon officer should only have minimal contact as they start to roll the suit down and away from your body. At this point, they should hold each sleeve, and you should pull your hand and arm into your suit, cross your arms over your chest, and keep them in this position. Once the suit is down below the knees, sit down on a clean surface. The decon officer may now remove the tape from the overboots. When using disposable coveralls and overboots, it's often easier to use trauma shears to cut or rip away the legs and overboots. If you are wearing reusable rubber boots, leave the tape in place and pull your feet out of the boots and suit together while the decon officer holds the boots. The APR mask can now be removed and decontaminated. It should be noted that aside from the inner nitrile gloves, respiratory protection should almost always be the last item of PPE removed. Finally, your inner nitrile gloves can be removed. Once all PPE has been removed, you should always wash your face and hands before drinking or eating.